Okay, surgical versus non-surgical approaches to the nose. There are a set of patients who are scared of surgeries, who don't want to undergo the knife, and they may have very, very subtle deformity corrections. So, one such deformity, which can be corrected without undergoing the knife, is the dorsum of the nose, the bridge of the nose, which we call. Patients may have a slightly depressed bridge. Now, the surgical way would be to put an implant or would be to put some other substances which can build up the nose. But the non surgical method is we use a combination of hyaluronic acid or maybe other products which will help in building up the bridge of the nose. And this is just like a lunch hour procedure where patients walks into the clinic, gets the procedure done, and when we can actually build up the dorsum of the nose or the bridge of the nose, elevating it, and in a jiffy, and she's or he's very happy with the result, and they can walk out. Also, there are some corrections which are related to the tip of the nose. They want subtle lifts of the tip of the nose. Even these patients can have the tips rotated up by just by giving injections. Now, we talked about injections as one method. The other method is the use of threads. This is a new method. It's coming up, still in the nascent stages. It requires a lot of expertise to do this, but people are getting it done, especially in the West. And India is not lagging behind. We are doing threads to actually augment or uh, enhance the bridge of the nose or even for tip correction. So, just like fillers, we use threads. Uh, to build up the the dorsum of the nose and even to rotate the tips. The implants, which are most commonly used for augmenting the nose, is silicone. Now, silicone has its own advantage. First thing is it's inert. It's inert. The revisions are very, very easy to do. Sometimes there can be a little bit of deviations. These silicone implants can be removed and readjusted, so it becomes very easy compared to the other implants where the revision or the removal can become very, very difficult. And subtle enhancements like improving or enhancing the bridge of the nose, silicone implants do very well. And where we do these enhancements is especially for the upper two-thirds of the nose, where that part looks depressed and that part needs elevation. Now, silicone is something which is ready-made, available. There are a lot of companies which market silicone. They come in pre-cut sizes and shapes. And all one needs to do as a plastic surgeon is to open the box, do a little bit of trimming, and again reinsert it back into the body. Now, you compare this scenario to borrowing the patient's own tissues. It could be from the back of the ear. It could also be a portion of bone which is taken from the forearm. It could also be a bone which is taken from the iliac crest. It could be the rib which is taken from the chest. All these are going to add to the surgical times. They are time taking. There is an additional scar. There is pain. So to cut all this, silicone does the job in my practice, and I use silicone. Okay, this is a very it's a very uh, common thing which runs in families. Noses looking very pickle. Now I've seen one family which had a longish kind of a nose where they have these prominent the tip looking actually plunging. We call them the plunging tips, very typical of it's all genetically determined, and the entire family has these kind of, you see one person you can say that they're related. So that's the kind of the picture we get when they come to us. Yes, I mean, this is a trait which is there in the family, and there's nothing wrong to actually correct or mend these noses. Also, there could be a lot of patients who have depressed bridges of noses. Again, this is a genetic trait. So, if the mother, father, parents have a depressed bridge, there's a likelihood that even the child is born with a depressed bridge of the nose, and even continuing into the adolescent and adult years. So, absolutely nothing wrong as long as the surgery is doing a world of good in lifting their confidences up. A trademark nose which a surgeon may give? It's a very, very important question. It's a very subtle question, but I like to address this particular problem by keeping the procedure, first of all, very simple. It has to be custom made, it has to suit the individual's nose. People might come to me and asking for make my nose look like one particular actor or actress, which is not correct. It may not be possible. So, in keeping the reality in mind, keeping the patient's characteristics in mind, whatever is best in that particular limitation, as a surgeon, I'll strive to improve the quality of the nose. But I cannot make two noses look similar, which means it's like a hallmark surgery nose. And nobody should be able to say that, okay, this is a plastic surgery nose. This is something which has been operated upon. So I don't like those kind of comments. I don't like unnaturality keep creeping up. I don't like patients telling me that, doctor, your patients have a very, very similar look. No, I like to keep things very subtle. I like to keep things very different. It's something like a bespoke rhinoplasty, where we give tailor-made nose suited for that particular individual. Again, this is absolutely a very, very important question, because majority of the time patients seek our intervention for cosmetic reasons. But when we examine them, we examine their noses, when we examine the interior of their noses, they might have a deviated nasal septum, which, if we again ask the patient question of whether they're having any breathing difficulties, they will say, "Yeah, I probably snore, or I probably have a difficulty from one aspect of the nostril." Around 15% of our patients have a deviated nasal septum, which is leading to a functional problem like breathing, or even in a worst of worst situation, they can have snoring. So when we again investigate, when we examine these noses, and when we get these CT scans done, invariably there is going to be some amount of deviation, and that can be corrected at the same time when they're going for a rhinoplasty. So this is called a septorhinoplasty, which means we address even the septal deviations, the septal corrections in the same sitting. So they have their functions addressed, they have their breathings addressed, and at the same time they're getting their looks back. Black eye or the swelling is actually a function, or what you see after a major rhinoplasty. So when I say major rhinoplasty, it means that we're breaking the bones. We're actually uh, breaking the bones to make the upper two-thirds of the nose narrow. So when we do the osteotomies or breaking of the bones in these patients, they may end up with black eye, raccoon's eye, or so-called bruising around the cheek, or the lower aspect of the eye. So this is something which is common after major rhinoplasties. Usually they settle down in a week, 10 days time. Some patients, it might even persist up to 2 weeks. Patients may even notice that there is some amount of clots in their eyes, which is called subconjunctival hematomas or ecchymosis. Even these conditions, they are temporary. They get corrected in or they subside in 1 to 2 weeks of time, and you don't have to do anything much, but to just give it time. Be patient. Everything's going to settle down. When you actually look at cosmetic surgery procedures and pain, rhinoplasty, blepharoplasties. These are procedures where pain is out of a scale of 0 to 10. You'll be surprised to see that the pain is only 1 or 2. They are absolutely like not, you know, painful. And although there might be discomfort is different from pain. Discomfort is because of stuffiness. We use splints; those can cause discomfort. But pain, as such, after rhinoplasty, very rare. So, should not be worried about pain. And even if this any amount of pain, we cover you with analgesics, and that should take care of your of the post-operative discomforts which you have. Very, very rarely do patients complain of pain after rhinoplasty.